POMGEN scales down services as third wave strikes. Shipping vessel quarantined after passengers test positive. And Parliament staff get vaccinated.
This is National EMTV News with Helen Seah.
Good evening and thanks for joining us for Wednesday's news. We have several stories on COVID-19 in the country, and we start off in Eastern Highlands where the Goroka General Hospital has scaled down operations despite a team of medical staff led by Dr. Gary No arriving in Eastern Highlands yesterday. The hospital is only attending to emergencies including COVID-19 related cases. Lopi Clinic in Goroka Urban LLG is closed while Goroka North Clinic is serving an influx of people.
On Monday, CEO of the Eastern Highlands Provincial Health Authority, Dr. Apa, said the situation in Goroka is unpredictable. Speaking to MTV News, Dr. Apa said the hospital is managing a situation that may go out of control if people continue to ignore preventative measures against COVID-19.
Yeah, unfortunately, in Novi and Ganadu are also having a big problem now, having an outbreak. So it's getting out of bed. So I mean, the simple thing is to protect yourself and get vaccinated. That's all. The new normal practice, and we are telling them. Everybody is visiting your home or is talking to you is a suspect. So you better be careful. That's what we're telling them now. So everybody is a suspect until proven otherwise.
Eastern Highlands is one of the 3 provinces with high statistics of reported COVID-19 cases. But the initial response by people in Goroka wasn't up to satisfactory. People coming into Goroka town were not wearing face masks and did not avoid crowded areas. But not all hope is lost. In Port Moresby, the Eastern Highlands Adventist Students Association raised over 34,000 kina as contribution to assist the Provincial Health Authority buy new oxygen cylinders to assist COVID-19 patients.
A lot of people have died because of COVID-19. The issue is becoming so loud that the Eastern Highlands Adventist Students Association cannot really ignore. So that's why it has taken this initiative to do a fundraising through a form of appeal to the general public, Eastern Highlands community, and also to business houses who are operating inside Eastern Highlands. The appeal started on Sunday, and it will end on October 10. We have already, over the past 2 days, we have raised 34,500 kina.
An employee of the Westpac Bank in Goroka told MTV News 3 of his colleagues tested positive for COVID-19. While he was at the hospital to do a rapid test, his aunt, who had diabetes, died from breathing complications. A journalist in Goroka posted pictures of people rushing into a pharmacy to stock up on medical supply. She told MTV News the scale down in the hospital operation is causing fear to many locals, especially those who are not yet vaccinated. So far as of last Friday, 35 deaths were recorded at the hospital as COVID-19 related. 3 more COVID-19 related deaths were reported the next day. While authorities in Eastern Highlands cannot provide an update on the new death tolls from Monday until today, it is believed those who died away from the hospital will go unreported. Tekla Gunga, National EMTV News.
The Morbe Provincial Health Authority has made a decision to move TB patients admitted at the new TB ward at Engau to a general medical ward in order to cater for COVID-19 patients. This decision has been opposed by staff who say they were not consulted, adding that TB operations will be affected if this happens. A patient at the ward aired his concerns today. Here's Lucy Kopana from Ley.
Sam Oyaya is a patient who has been admitted at the TB ward for the past 8 months. He is one of 12 other patients who are taken care of here at the Engau Memorial General Hospital's new TB ward. While this ward was purposely built to house TB operations, they're now being ordered to move to a general medical ward in order to free this building for COVID-19 patients. Mr. Oyaya said this is a concern for him and other patients as well.
We ask him all, this authorities long, look him all, said, TP all, one hiana, please give him kind good blah, look savilo me blah.
Last week, the Provincial Health Authority's Chief Executive Officer, Dr. Kipas Binga, confirmed that there were up to 17 patients admitted at the COVID-19 center at the Ser Ignatius Kilage Indoor Stadium. He also confirmed the deaths of 6 patients. In a circular dated the 20th of September, the Health Authority's senior executive management team gave instructions to move the TB patients to the 7C General Medical Ward and patients from this ward to be moved to the psychiatric ward. Dr. Binga said this decision was made because the number of cases are increasing and treating COVID-19 patients off hospital grounds is costly.
In the weeks ahead, maybe next week or so, we might be moving the patients from the current back into the hospital, just so that it's easier for everyone to look after. We don't have
Staff responsible for the wards that will be affected said there was no consultation before the circular was issued. They held a meeting today to air these concerns and hope to have an audience with the CEO tomorrow. Lucy Kopana, National EMTV News, Ley.
As a result of the Morbe Provincial Health Authority's circular being implemented, psychiatric patients were discharged this morning to free the ward for general medical patients to use. According to the nurse manager Manosa Uki, there have been no further instructions from the management as to how psychiatric patients will be catered for during this period. Calls and text messages to get a response from the MPHA CEO, Dr. Kipas Binga, regarding these changes were not responded to. In Medang, the Lutheran Shipping Company has been instructed to quarantine its vessel, Mamose Express, for the next 14 days until it is cleared by the COVID-19 team. Provincial Health Authority CEO Fidelis Waipma issued the directive as per orders from the National Control Centre. This comes after 17 passengers travelling in from East and West Sepik provinces tested positive for COVID-19.
The Lutheran Shipping Agency Mamose Express was formally informed in a letter of the dangers associated with the ship and passengers travelling to and from East and West Sepik and Morobeh provinces.
The vessel is, yesterday I issued the instruction to the ship owners, the Lutheran Shipping. The vessel will be quarantined for the next 14 days.
The CEO, in his capacity as the Deputy Chairman of the COVID-19 Committee, sought instructions from the National Control Centre to isolate the shipping vessel due to the recent surge of COVID-19 and Delta variant in West Sepik province.
Yes, we are now putting up our strong surveillance. Our team is gaining momentum. We are in contact with our team from Ramu, Suga. We have sets coming down from Eastern Highlands. The highway is still open, and the boats are still accessing our waters into Medang. So sets is, I am pretty optimistic that we will be experiencing sets within the next 2 weeks.
NCC directed the COVID-19 team to monitor the captain of the crew and carry out tests on them for the next 7 days before the ship is released on day 14.
For Medang province, they are now under our radar for further investigation and contact tracing. And as well as we've encouraged them to stay in-house, not to go in contact with their family members and their loved ones, to stay, isolate themselves and stay at home and for the next 14 days, whilst our team will, from time to time, will go in and do some visits to them and find out on their medical conditions.
The ship will be allowed to depart after the 14 days if the result of the crew members is negative. However, the company will be penalized under the Pandemic Act 2020 if it fails to comply with the directions. Last Friday, the surveillance team identified 17 positive COVID cases from passengers coming from Western East Pacific provinces. 10 of them are from Madang, while 7 are from Leh, including 2 crew members.
So that ship, there's roughly around 300 plus passengers on board. Especially, I think you'll find a lot of mothers going for that Catholic Women's Conference.
Madang PHA CEO Fidelis Wine says the company had breached the COVID-19 orders, carrying more than 300 passengers. The infection and control team had disinfected the vessel.
Downstairs, upstairs to one, there were passengers on that room.
Martha Lewis, National EMTV News, Madang.
You're watching National EMTV News. We'll have more stories after these messages. Stay with us. Welcome back. Port Moresby General Hospital has scaled down a number of clinical services amidst the third wave of COVID-19 currently experienced in the country. In an exclusive interview earlier today, POMGEN CEO confirmed the scale down will be for 2 weeks starting today.
Authorities have revealed the nation's capital accounts for the highest number of cases reported in the last 24 hours. Port Moresby General Hospital CEO says numbers have tripled.
Towards the end of September, 27 September to now, we have seen increased number of COVID cases coming into our hospital. Initially from 27 September to 28, 29, the positivity rate was 31%. It's only increased to 40% and 50%, meaning that 5 cases of 5 out of every 10 cases presenting with flu-like cough, fever are tested positive for COVID. In the last 24 hours, this has increased to 61%. Currently, 89 patients admitted in the hospital. Our 18-bed isolation ward is full, so we have opened up another ward to accommodate the increased number of cases.
Following the surge, POMGEN has released a circular number 39, scaling down of services.
Circular number 39 for scaling down is so that we close down some of the non-essential areas like the consultation clinics, elective surgery, so that we free up some of the staff to remobilize the staff to those areas so that we can contain the surge. This is for 2 weeks. We will scale down.
Dr. Molumi is calling out to the public to be vigilant.
The only way we can save our fragile health system is to get as many people as vaccinated as possible so that we don't get them into the severity of COVID and we can get them into the ICU care or demand for oxygen because we don't have many of those. So I would encourage all our population to get themselves vaccinated, to protect themselves, to protect their family, and of course to save our fragile health system in the country.
Kilawani, National EMTV News.
A patient at the Florence Nightingale COVID-19 Centre in Port Moresby has been transferred to Port Moresby General Hospital after experiencing severe COVID-19 symptoms. St. John's CEO Matt Cannon said the patient's condition was deteriorating with hypoglycemia and decreasing oxygenation. Apart from that, 12 other patients are also admitted at the centre with mild to moderate symptoms. 7 are male and 5 are female. 8 are currently on oxygen supply and 4 have mild conditions. St. John is managing the COVID-19 centre at Tarama Aquatic Centre. Its ambulance service has also seen an increased workload responding to emergencies in NCD, Central, Leh, Kundiawa and Kokopo. Parliament Speaker Job Pomat says COVID-19 is real. He recovered from contracting the virus in April this year. After being ill for 5 weeks, the Parliament Speaker was amongst close to 200 parliamentary staff who were vaccinated today. In Port Moresby, vaccination sites are set up at the Vision City Mall and the National Football Stadium. However, the choice to be vaccinated rests upon individuals.
Papua New Guinea is seeing a surge in COVID-19 with reported cases of the Delta variant strain. The national government, led by Prime Minister James Marape, is calling on citizens to be vaccinated as protection against the coronavirus. Parliament Speaker Job Pomat was amongst staff of the National Parliament vaccinated today. This is the first vaccination station that was set up at the Parliament House.
Thinking because sick and come strong. So you may all get must kiss him. But I'm a choice for one man you make him this blood. Me yet me been kiss him sick this like COVID-19 long moon March. After long go we work lo burial blow Grand Chief St. Michael. Me come back and me put down straight. And I was down for 5 weeks. 5 weeks now, me kiss him this like COVID. And time me kiss him, me sleep, stop me feel him. And mix him short wind, big no short wind. And I believe that is the headache. If you overcome that headache blow short wind, shortness of breath, you will come back. If you don't know, you succumb to it, then you buy bagarap this flash. So me experience even is a sick COVID, it is real.
The vaccination rate in Papua New Guinea remains relatively low compared to other Pacific Island countries. But now with the third wave of the coronavirus being felt across Papua New Guinea, more people are turning up to be vaccinated. The vaccinations which are now available in country include the Oxford Zeneca, which has a 63% protection rate against the coronavirus, and Johnson & Johnson, which has a protection rate of 66% against the respiratory disease. In Port Moresby, vaccination sites are set up at selected venues, including shopping centres for the public to be vaccinated. As per statistics released from the St. John Ambulance, 288 people were vaccinated at Waigani Central in the last 3 days.
Me looking vaccine, I'm also one blah. All kinds should before you me picking a bonus aximia, immunize you me or. But this like you me looking experience stuff, guarantee but you don't have Kishimogo that's a sick COVID-19 again. But I help him long down him this law.
On a national scale, 3 provinces have been marked with a red tape, indicating the need to practice preventative measures against COVID-19. Western, West Sepik and Eastern Highlands provincial health authorities are now managing high severe cases of COVID-19. In an earlier interview with CEO of the Eastern Highlands Provincial Health Authority, more people in Eastern Highlands have lined up to be jabbed following the surge in COVID-19 cases in the province. Theklagunga, National EMTV News.
3 NBC employees have been suspended after a video they produced about the side effects of the COVID-19 vaccine went viral. The video sees the men experimenting the alleged magnetic effects of the vaccines, putting a coin on the injection spot and describing how it felt. The 3 are staff from NBC Vanimo. In a statement, NBC Managing Director Corin No said the video does not represent the views of the organization as the production of the video wasn't sanctioned by the NBC. He said NBC has a clear mandate to inform, entertain and educate and is not qualified to medical information on COVID-19 pandemic. There is also always high demand for blood transfusion to give blood to those in need of it, the ones in hospital. The Sir Brian Bell Centre for Transfusion Medicine, Port Moresby's blood bank relies on blood drives to get volunteers to donate. Today, the staff at the Sanctuary Hotel donated blood.
Blood, it is needed to keep us alive, bringing oxygen and nutrients to all parts of the body so they can keep working. While those living have the blood, not all have enough, and it is also much sought after. For Port Moresby's blood bank, the Sir Brian Bell Centre for Transfusion Medicine, blood is always on high demand.
We do collect enough, I should say, but however, the demand is high because we serve not just Port Moresby General Hospital, but we serve other private hospitals as well in the city.
It takes a blood drive similar to this one, today hosted by the Sanctuary Hotel, to get the much sought after blood to the blood bank. The staff of the hotel donated some of their blood with the intention of saving a life.
My late father was in 2015 and took a problem on them blood. He has no blood, so I decided to first give him my first bag blood. So we donating blood lamps. So now last Kimilo donating blood, meeting was a saying one blood life, so donating blood.
Beauty contestant Miss Sanctuary and Rapopo also gave a bag of blood.
There's a lot of benefits when you do donate your blood. It's not just helping people, but you're also finding out about your status, your health status. So I encourage anyone to donate blood. For those who are not sure enough, they can find out more information or even call the youth blood drive and just find out.
While most don't donate blood, many require it. Those that have illness can be saved. Those going for operation or who have been in a nasty accident. When you donate blood, it gets replaced and it comes with benefits.
Every 120 days, the body makes new blood. So it's good to donate blood, and so your body makes new blood products for you, and you're reducing the risk of having high blood pressure that may lead to stroke and other heart diseases as well.
A bag similar to this one donated can save 3 individuals.
Whatever the patient needs and is requested by the doctors, the lab scientists prepare the products accordingly. So if the patient needs the whole blood, then the whole bag is given. But if the patient needs other components of the blood, then it is prepared according to their needs.
But blood donation is not for everyone. But with each intention of donating, a chance to get clinical advice, to find out if there are other illnesses hiding in your blood.
If the blood pressure is too high, then we counsel them. If the blood level is too low, then we discuss with the donor and we can refer them for further help. Once the donor is eligible to donate, he or she donates blood, they get to know their blood type, which is very important. And we also screen for infections such as HIV, hepatitis B, and syphilis. So the donor gets to know their status. Should there be any infections, then we refer them for treatment.
Fidelis Sukina, National EMTV News.
Now looking at the NASFund market report, the Kina closed unchanged at $0.2850 in the interbank market. At Bank South Pacific, your Kina is buying $0.2775 $0.3766 Australian dollars, $0.2312 euro, and 30.33 Japanese yen. Looking at commodity prices at New York close, gold is trading lower, coffee closed lower, cocoa and copra closed higher. Crude oil is trading higher, palm oil closed lower, and copper closed higher. And on the stock market, the Dow Jones closed at 311.75 points higher. The ASX 200 is trading at 41.8 points lower, and the ordinary is trading at 40.2 points lower. National EMTV News continues with more stories after the break. Stay with us. Welcome back to the news. NCD Governor Paul Pakop is standing strong on his awareness for COVID-19 vaccination. With the spike in Delta variant cases, Governor Pakop says it is enough with the talking. He urged citizens to come forward and get vaccinated.
While presenting the mobile clinic buses to the residents at Goma Sasipo, NCD Governor Paul Pakop is still pushing for residents to come forward to get their jab. Pakop says the situation in the country right now is serious and urgent.
Migen togi yubla community yubla kambu. Kotmas General Hospital now, the isolation ward and pull up penis. About 1 or 2 weeks ago, and pull up that's all. Mipla Holenbeck stopped trying to manage.
Due to the spike in the number of cases, Pakop says the position we are in is beyond manageable. He is appealing for everyone to get vaccinated.
I'm giving you higher protection. Second two, so as you sim, you got higher chance of recovery up. So me at Miluki Muslim, there's only one solution that will work. One bla rota solwe and by helping you milo. Finishing this pandemic or countering this virus inside law. City blow you mean a country blow you mean. That's the vaccine.
Governor Pakop stated that the government wants to impose a lockdown, but he is going against the idea. He says the lockdown will affect businesses.
Must be me no like lockdown. You will try to something lockdown me no like it. So, Mr. Nablo is a position yet. The private sector now only under pressure. Value working money also on him. Trading in going come, international trade and pass. Inside law, city na country to kind restriction come up na. Business no grow. So how will the government tax the private sector na?
Podivai National EMTV News.
Relatives of a PMV driver killed outside Tari have carried out a peaceful protest in Mendi town. Covered in mud, the grieving relatives from Upper Mendi marched into town, demanding answers and compensation from leaders of Hela province. The deceased, Yapo Pinzele, is a bus driver who had been serving people between Mount Hagen, Southern Highlands and Hela provinces for more than 20 years. He was shot and killed along the Ambua range last week by thugs. A prepared petition by community leaders is being compiled for the Hela provincial government and is addressed to Governor Philip Undialu and Tari Pori MP and Prime Minister James Marape. The petition demands 800 pigs and 4 million kina. The relatives of the bus driver want those responsible behind bars and the authorities to pay compensation this October. They also want the body of late Yapo to be officially handed over to his people in Birop, Upper Mendi. The aggrieved relatives say if nothing is done, they have warned to stop all movement of vehicles, cargo and other services operating between Mendi and Tari. Village oil palm communities in Milne Bay province were happy with the engagement of youth in the oil palm rehabilitation project. Not only was it a source of extra income, but it kept the youths busy.
Village oil palm communities in Milne Bay province couldn't say thank you enough to the Oil Palm Industry Corporation for contracting village groups to carry out oil palm rehabilitation work in the province. 26 contracts were awarded, with most of the work completed last week and payments made. In collecting their payments, many expressed their concerns on the limited opportunities available for youths in the province.
System, the life, the place, because boys are drinking there, swearing there, they're shouting it like, even though they, Mara, Father, Pasta, all stuff, but they didn't respect them. So now people are carrying the income, people must through the government will make him more same thing.
Like our young people today, they are involved in so many things, but when this kind of program came up, this contract was formed, and like when the information came down to us as localized villagers here, our boys, we began to see that like they are happy to take part in this kind of program. So they all got involved. And many of them like did work. They took part in the contract.
chairman of the Milling Growers Association, Stuart Tataro, said it was pleasing to see a lot of youths taking part in the program.
We're very happy that we've got the youths involved heavily in the rehabilitation, because youths have become a problem and an issue within our blocks. We now have blocks that owners have around 2-3 children, and they're all fighting over the blocks and engaging youths like this. So, their involvement also into the block.
In appreciating the opportunity given by OPIC, youths call on the local and national government for more involvement and opportunities in agriculture.
So, mipla like mipla lo building mipla kian. Itini man. So, on behalf of mipla council mipla tu lo borowai tu. I'm just losing mipla yet itini. So, thank you VOP lo kam na building mipla lo. Own strength belum mipla lo building more youths belum mipla kamanta.
Mipla hamama straight lo government working one something now. Mipla looking mipla or place line mipla hamamas lo. Suppose all enough lo come back again na. Helping mipla this la kind. Funding mipla lo make him this la sampla or work. In now all by can kiss him go on top lo bigger contracts or this la kind.
If the government could continue to help and assist in this kind of programs, we know and we believe that our young people are going to really change by getting themselves in this kind of activities.
The contract awarded by OPIC was for clearing oil palm blocks and pruning palms so to maximize fresh fruit harvest. This is OPIC's effort under the management of General Secretary Captain Pupita to increase the yield of fresh fruits produced by smallholder farmers. Similar contracts were also offered to groups in West New Britain, Northern and New Ireland provinces. Shamin Poreambev National, EMTV News.
The third PNG Cocoa Show of Excellence has been postponed indefinitely. This is due to the new measures set by the National Controller with regards to the current surge of COVID-19 cases in the country. The show was initially planned to start tomorrow. Simbu Provincial Government, the host of the show, has sincerely apologized to sponsors and stakeholders and will advise on new dates once the restrictions in the Highlands have been eased. Trukai Sports is next. All the details after the break.
Trukai Sports.
Welcome to Trukai Sports. The Papua New Guinea Sports Foundation has closed all its venues and services across the country. This is effective until the 30th of October, when it will be reviewed upon advice from the National Control Centre.
Last week Friday, Papua New Guinea Sports Foundation Executive Director Albert Veratau and PNG Olympic Committee Secretary General Alvita Rapila met with NCC's new Pelapasin team to discuss a reprieve for sports. While PNG SF and other sports administration rely on sports as their livelihood and a means of employment, the directives from the National Control Centre for COVID-19 will see the closure of all venues. This means staff working at these venues will be laid off. PNG SF Pandemic Management Committee Chairman Dr. Kapua was engaged to continue discussions with the new Pelapasin team and Deputy Controller this week. However, over the weekend, the surge in the Delta variant has become a concern for the sporting community. Therefore, after a careful consideration, the PNG SF and PNG OC have decided to shut down all its venues and services until the end of this month. This is necessary to protect all athletes and assist the Department of Health to prevent the loss of lives. Suli, Trukai Sports.
And that ends Trukai Sports, where the details coming up next.
Trukai Sports. Trukai Sports.
This weather update is proudly brought to you by Moniplus, with you always.
I'll look at the weather forecast for tonight and tomorrow. Mostly fine, although partly cloudy in Port Moresby. Mostly fine weather in Daru. Partly cloudy with possible showers and thunderstorms in Kerema and Alatau, and cloudy with a few showers in Popondetta. In the Mamasa region, cloudy with a few showers possible in Lae. Showers and thunderstorms in Medang, and cloudy with a shower or two in Wewak and Vanimo. In the New Guinea Islands region, cloudy periods with rain, showers and possible thunderstorms in Lorengau, KV and Kokopo, Rabaul and Kimbe, and cloudy with some showers and thunderstorms in Buka. And in the Highlands region, cloudy with some showers and possible thunderstorms in Mount Hagen, and partly cloudy with some evening showers in Goroka, Kundiawa, Mendi and Wabeg.
The weather update was proudly brought to you by MoneyPlus, with you always.
And that's been the news, sport and weather for today, Wednesday, 6th of October 2021. Until next time, pleasant viewing, be safe and good night.